Good morning and welcome to Morning Coffee with Gail and Janet. Let's talk health and Medicare. I am your host, Gail E. Lawrence, along with Janet and Yesenia. And we're here this morning to give you information on health insurance and Medicare. We want you to know your options. What we want to do is make sure that you know what you can apply for, when you can apply for it, and what benefits are there waiting for you. So to get started with this morning, I'm gonna ask Janet to go ahead and tell us about the health insurance.
Yes, good morning, everyone, and welcome to this morning session. And like Ms. Gell said, we will be talking about healthcare this morning. Now, the healthcare, it is normally beginning around November 1st. That's the enrollment period of which it begins. Now, there is a special enrollment period that also happens during certain events. Which we will talk about right now in the next slide. And it usually happens when one will lose coverage within the next 60 days or has lost coverage in the past 60 days. Or if you had an event like getting married, had a baby, gained a dependent, if you were denied Medicaid or CHIP, if there was a change in immigration status, or if you got divorced or legally separated and that's how you lost your health coverage. Now, the following things that we will need in order to be able to apply for health care is your full name, your social security number, your date of birth for those that are under the age of 65, your address in your county, your phone number, email if you have one, number of people on your tax return, your yearly adjusted gross income, your employment name, and the address of your employment, and also the phone number. Now, if you're self-employed, we would need the type of job that you work in, like a description of your job. Now, if you don't qualify for the special enrollment period, what we have is a plan that we can put you in until we're able to put you on a full plan during the enrollment period, which is in November 1st, like I have mentioned before. Now, for those that are turning 65 and over, Ms. Gail will tell you more about that. But also, if you need any information or have any questions, please give us a call at 817-381-1500 and just leave your name and email and we will get back to you as soon as possible. Ms. Gal?
Thank you, Janet. All right, so what I'm going to talk about is for people that are age 65 and over, and some you can qualify for other criteria too. So I'm going to talk about Medicare. Medicare, again, is a plan for those that are age 65 and older, and some other criteria can get you into Medicare. Now, when we talk about Medicare, I want us to go back to grade school and with our alphabets, A, B, C, and D. They have very important parts to play in what we'll be talking about today, Medicare. Now, when you are turning 65, as I mentioned earlier, also, if you've been on disability for 2 years or more, you qualify for Medicare, and certain chronic conditions will have helped you to be qualified for Medicare also. Now, in Medicare, we have the A part of the alphabet. A is, I say, anywhere you lay your head. That's what the Part A pays for: hospital, hospice, nursing home, at-home care, any place you lay your head. Now, a lot of people will tell you that your Part A is free. It is not free. When you worked or your spouse worked at a company or on self-employed, whatever, for 10 years or more, and you earned enough credit, and every time they took that money out of your paycheck, that's what you paid for Part A. Now, Part B take care of your doctors, your tests, your MRIs, your durable medical equipment, things like that, outpatient surgery. This is what your Part B pays for. Now, there is a premium associated with that Part B, and sometimes we can assist you with help paying those premiums. So if that's the situation, just give us a call at our office and on our voice and text number, and we can assist you with that. Now, Part C is really not a part of Medicare. It is a plan called Medicare Advantage. So when they made Medicare Advantage, they made the Part C. So in order to have the Medicare Advantage, you must have Part A and Part B to be Part A here and Part B to be on Medicare. That equals C. And most of the Medicare Advantage plan include your drugs also. Not all, but most of them include your drug plans. Now, when you become eligible for Medicare, you have three choices. Choice number one, Medicare plus a drug plan, or Medicare plus a supplement. Sometimes they call it Medigap. Medigap and supplement is the same thing. Or you can go on a Medicare Advantage plan. So those are your three choices. Now, if you just keep original Medicare, you will need to pick up a drug plan, because if you do not pick up a drug plan within 63 days, you will pay a penalty of 1% every month that you could have been in the plan and were not in the plan. And you will face that penalty for the rest of your life. Now, in some situations, again, we can assist you if that is your case. If you fall into that situation, didn't know at the time, just give us a call at our office number, 817-381-1500, and we will do our best to assist you. Now, with the Medicare, you have Medicare pays 80%, and then your supplement, you're responsible for the 20%. In that case, you'll get a supplement which has a premium, and you will also need to, again, pick up that drug plan. And then the third choice, Medicare Advantage. Medicare Advantage has to be just as good as Medicare, original Medicare, or better. So Medicare Advantage plan usually includes your doctors, your hospital, your drug plan, and then some additional benefits that you can get with the Medicare Advantage, such as sometimes you can get glasses, dental work, plans for meals when you come out the hospital, just a whole lot of benefits and a lot of care coordination with the Medicare Advantage plan. Most of the Medicare Advantage plans have a zero premium, and you make copays. Now, on the next slide, we want to let you know that if you are turning 65, or if you've been on disability for 24 months, whatever the situation, if you have a chronic disorder and you have not received your Medicare card, you would think you would go to Medicare, but you actually go to Social Security. Go to Social Security, SSA.gov, and apply for your Medicare card. Now, you qualify for Medicare when you're turning 65, 3 months before your birthday, the month of your birthday, and 3 months after your birthday. If you need some assistance applying for that, or some guidance applying for that card, again, give us a call at our office number, 817-381-1500. At this time, we are open. If anyone have any questions, Yesenia, are there any questions in the chat room?
No, ma'am, not at this time.
Not at this time. Okay, again, we thank you for joining us this morning for Let's Talk Health and Medicare, Morning Coffee with Gail and Janet. We normally run this from the office every Monday morning, but due to the pandemic and the things that are going on right now, we are practicing safe distancing, but we still want you to have this information because everything is still time critical, and our health is our wealth. So if you have any additional questions or you want to make a one-on-one session with us, give us a call at our office, 817-381-1500. You can also reach us on our website, which is gelhealthadvisors.com. Thank you and have a blessed day.